and the involvement of multiple prescribers, which, in effect, obscured an accurate diagnosis and appropriate intervention and treatment. Furthermore, the psychotropic medications she received appear to have paradoxically exacerbated her underlying psychiatric vulnerability, precipitating a state of manic psychosis characterized by compelling command hallucinations. Dr. Zeisel noted that Lindsay's parents conveyed profound shock and devastation at the depth of her psychological decompensation, indicating a prior lack of complete comprehension regarding the actual severity of her underlying illness. This underscores how the medical providers failed to adequately communicate the severity of Lindsay's condition or take appropriate action. J. Defendants' violations of the standard of care. 92. The standard of care required defendants to obtain a complete psychiatric history, including detailed inquiry into Lindsay's mood and symptoms during and after her prior pregnancies. Had any of providers done so, they would have learned of hypomanic episodes that followed her second and third deliveries, which were critical indicators of bipolar disorder, postpartum onset. 93. The standard of care required defendants to recognize that Lindsay's severe adverse reaction to Zoloft, characterized by activation, worsening insomnia, and racing thoughts, was a red flag for bipolar disorder. The standard of care further required that after a second antidepressant caused similar activation, defendants should have diagnosed bipolar disorder and prescribed a mood stabilizer rather than continuing to try antidepressants. The standard of care required defendants to conduct appropriate testing, including blood plasma levels of medication, to determine why Lindsay was having adverse reactions to relatively low doses OT medication and VVA is a slow metabolizer. 95%. The standard of defendants to follow the start low and go slow principle VVH and prescribing medications, particularly given Lindsay's demonstrated sensitivity to psychotropic medications. Instead, defendants added and accelerated medications in an ad hoc manner that radically increased the risks to Lindsay. 96. The standard of care required defendants to inquire into the content of Lindsay's intrusive thoughts, if which were actually audited hallucinations. Had they done so, they would have recognized the psychotic nature of her symptoms and the danger she posed to herself and her children, including the danger of postpartum psychosis. 97. The standard of care required defendants to coordinate care among themselves and with other treating providers. Instead, the providers failed to communicate with one another, and Nurse Aloud did not even return women and infants called to discuss Lindsay's care. 98. The standard of care required defendants to seek collateral information from Lindsay's family members. VVHO could have provided crucial information about the severity of her condition and her functioning at home. 99%. The standard of care required defendants to recognize that Lindsay, as a patient suffering from severe postpartum mental health disorders with suicidal ideation, posed a risk of harming not only herself but also her children. 100%. The standard of care required McLean Hospital to provide adequate inpatient care during Lindsay's brief admission, properly evaluate her condition, and ensure appropriate discharge planning rather than discharging her after 5 days with limited insight and judgment back to the same providers who had been providing inadequate care. 101. The standard of care required women and infants to properly evaluate Lindsay, obtain an adequate psychiatric history including inquiry into her early postpartum period, and recognize the signs of bipolar disorder, rather than dismissing her severe depression scores and recommending medication changes without proper follow-up. 102. Defendants knew or should have known that Lindsay presented a real, clear, and present danger of harm to herself and her young children. 03. Defendants' collective failures to comply with the standard of care, more likely than not, directly and proximately caused the injuries suffered by Lindsay, including Lindsay's killing her children and attempt to kill herself. Negligence, medical malpractice, personal injury. 104. Plaintiff repeats and realleges the allegations contained above as if fully set forth herein. 105. All defendants owed Lindsay a duty to exercise reasonable skill and attention in their care and treatment of her psychiatric condition. 106. Defendants failed to exercise reasonable skill and attention in caring for Lindsay, and their conduct deviated from accepted standards of medical practice, as set forth above. 107. As a direct and proximate result of the negligence of defendants, Lindsay suffered severe personal injuries, including but not limited to the loss of her three children, Cora, Dawson, and Callan, the development of severe postpartum psychosis, with connue and auditory hallucinations, a thoracic spinal cord injury, resulting in permanent paralysis below the sternum, multiple closed fractures of the cervical and thoracic vertebrae, multiple rib fractures, neurogenic bowel and bladder dysfunction, impaired mobility requiring the use of a wheelchair, severe psychological trauma. 108. Further, the acts and omissions of defendants constituted gross negligence and a reckless indifference to the health, safety, and welfare of Lindsay, and shoved reckless disregard for the consequences which defendants knew or should have known could result from their acts or omissions. 109. As a result of foregoing, Lindsay is entitled to recover damages from defendants including, without limitation, past and future medical expenses, past and future lost VVHs, pain and suffering, emotional distress, including the knowledge that she killed her children, loss of enjoyment of life, permanent disability, and other damages in an amount to be determined at trial. Loss of Warranty Consortium. 110. Plaintiff repeats and realleges the foregoing allegations as if fully set forth herein. 111. At all relevant times, Lindsay Vivi is the mother of Cora, Dawson, and Callan. 112. As a direct and proximate result of the negligence, recklessness, and gross negligence of defendants, Lindsay has suffered and will continue to suffer the complete and permanent loss of companionship, consortium, services, society, comfort, guidance, counsel, and advice of her children Cora, Dawson, and Callan. 113. As a result of foregoing, Lindsay is entitled to recover damages from defendants in an amount to be determined at trial. Loss of spousal consortium. 114. Plaintiff repeats and realleges the foregoing allegations as if fully set forth herein. 115. At all relevant times, Lindsay was married to Patrick Clancy. 116. As a direct and proximate result of the negligence, recklessness, and gross negligence of defendants, Lindsay has suffered and will continue to suffer the loss of the normal marital relationship with her husband, including loss of companionship, consortium, society, comfort, guidance, counsel, advice, and conjugal fellowship, as a result of the devastating impact of the events of January 24. As a result of foregoing, Lindsay is entitled to recover damages from defendants in an amount to be determined incorporates. Plaintiff incorporates by reference all preceding paragraphs. A Dr. Tufts was an employee, agent, or servant of health at all times. 3. Agent or servant of VADA was an employee at all times relevant to this complaint. Scope of her employment. Under the doctrine of Respondent Superior, Astra Mental Health is vicariously liable. Respondent Superior, South Shore Health Systems, Inc. is vicariously liable for the negligent acts and omissions of Nurse Gelada. B. Average plaintiff damages, including punitive damages, as allowed by law, for the personal injuries suffered by Lindsay Clancy, including her physical injuries. Wherefore, plaintiff prays that this honorable court A. Enter judgment in her favor on counts I through 3, psychological trauma, loss of consortium via her children and her spouse, and all other damages permitted by law v. plus interest as allowed by law from the date of this complaint, plus costs and attorney's fees, and C. Grant such other and further relief as this court deems just and appropriate. Respectfully submitted, Lindsay Clancy by her attorney, S. Rosemary Kearns Capicchio, Rosemary Kearns Capicchio. Date filed January 22nd, 2026, 4:12 p.m. Superior Court, Norfolk docket number. Lay v. Office of Rosemary C. Capicchio, 107, Massachusetts. Union